Hi everybody, in this video we're going to start going through embalming fluids. It's very similar to what we did in embalming class for embalming fluids. It's just a little bit more in-depth. We're mainly going to look at arterial fluid and the components that you'll find in arterial fluids. Again, the arterial fluid is what you inject into the arterial system to perform embalming. It's what contains your preservative. Now, different arterial fluids will have different components, but it can be composed of several different things. It's always going to have some kind of preservative. That's what makes it an arterial fluid, is the preservative. Could have some additional supplementary germicides in there to help with disinfection. Could have some modifying agents, such as the things that you might add as a co-injection, actually. So these modifying agents would be things like anticoagulants, surfactants, dyes, deodorants, and or vehicles. And we're going to kind of look at all of these little things a little bit more in depth. So most arterial fluids will have at least preservatives and vehicles. So the vehicle is the embalming fluid solvent. It's what the preservative is being dissolved in. Vehicles technically should be things that do not react with the active components of the embalming fluid itself. That would be bad if the vehicle is going to react with the components of the arterial fluid and then they don't work. Nor should the vehicle really react with the tissues of the circulatory system. The most common vehicle is water, honestly. But there are three main vehicles that are used in embalming fluids. Water being the main one. Also methanol, you're going to find that in all formaldehyde-containing fluids, again because that methanol is there as a antipolymerant to stop methylene glycol from turning into paraformaldehyde. Another common one is glycerin, otherwise known as glycerol, same thing. Remember, that's that trihydroxy alcohol. It's used for a lot of different things in embalming, vehicle being one of them. So suspended within the is the preservative. The preservative is what renders proteins immune to digestive enzymes. It's also what's going to inactivate those enzymes, as those enzymes are proteinaceous. Three main types: the aldehydes, glutaraldehyde, formaldehyde. Alcohols technically are preservatives too. They're just a little bit different type. They're precipitant preservatives. The alcohols that are in embalming fluids, by and large, are there as either antipolymerants or as additional solvents, but they can add to the preservative quality of an arterial fluid. There are some green fluids nowadays that are all methanol based, so they don't have any aldehydes at all. It's just straight methanol. Freedom Cav and Freedom Art are the Dodge versions of this. And then phenolic compounds. Now, we don't tend to use the phenolic compounds as arterial preservatives. It's more specific preservatives. So, for instance, I want to cauterize tissue, preserve it. Phenolic compounds are good for that. So the aldehydes, again, there are two main types, the monoaldehydes and the dialdehydes. The monoaldehyde would be formaldehyde. Again, formaldehyde will firm tissue. The main thing for formaldehyde is that it will dehydrate tissue. So it firms quicker than glutaraldehyde, but again, glutaraldehyde firms better over time, but formaldehyde will dehydrate tissue much better. Then the dialdehyde, glutaraldehyde. They have tried other dialdehydes. If you remember, we talked about like glyoxal. Glyoxal would preserve tissue much like formaldehyde, but it turns it yellow, so they don't use that. They've even tried some bigger molecules than glutaraldehyde, like vanillaldehyde, which I think is like a 12-carbon dialdehyde. But glutaraldehyde is the main one. Again, this will produce more linkages over time. It does not react it doesn't diffuse as quickly as formaldehyde, so it takes a little bit longer for it to get into the tissues. And that's why embalmers don't like to tend to use glutaraldehyde, because a lot of embalmers will embalm by touch. The alcohols, you have the monohydroxy alcohols, like methanol. Again, methanol is mainly there as a formaldehyde antipolymerant. It is there to stop methylene glycol from turning into paraformaldehyde. It's the most commonly used alcohol because most arterial fluids are going to be formaldehyde based, and so methanol is going to be added to stop it from turning into paraformaldehyde. Ethanol is probably the second most commonly used. You see this in high index fluids because ethanol is used as an additional solvent. So ethanol is a very good formaldehyde solvent, lets you go past that 40% ceiling in formalin, allows you to get up to like 50s indexes. And then isopropyl alcohol, technically used as a germicide, not so much in embalming. It's technically used a little bit more for first aid, if you will, and or a solvent for removing things like iodine or bandage adhesive. So those are the alcohols that you'll see in embalming fluids, used as some kind of possible preservative anyway. The phenolic compounds, again, we don't really use phenol anymore. Now we're using more mortuary bleaches, which are phenolic based, but they can be used as preservatives. This is true. The cadavers that we use have a lot of phenol in them. Most of the time, though, we're going to use them as bleaching agents to get rid of discolorations, extravascular discolorations like postmortem stain or purpura or ecchymosis. They also work well as cauterizing agents for searing tissue to avoid leakage. If you remember, phenol is a pretty decent disinfectant. Works best as a disinfectant at 5%. Any more than that, and you're just getting it more caustic, and it's not really going to kill anything more. But they suggest that you don't use phenolics with aldehydes. And what they mean by that is you would not mix a phenolic compound in a tank with an aldehyde. Because when they mix, they're going to discolor tissue. It will create a gray discoloration, which most of the time we're using phenolics for surface embalming, again, cauterizing of tissue, and that gray discoloration is not that big of a deal in that case because it's not in a visible area. It's also kind of helpful to know that the tissue has actually had the phenol absorbed into it, so it's turning gray because it's mixing with the aldehyde in the tissue. So we wouldn't ever mix phenol and formaldehyde in a tank, but phenolic compounds are fine to use on tissues that have been preserved with an aldehyde. So some examples of arterial fluids, things like medicine. Medicine has a wide range of examples between 20 and 35. High tone is Champions, that's formaldehyde based, and the Fax is glutaraldehyde based. Now the supplemental germicides are not necessarily mixed in with the arterial fluid. Again, some are, but the more common ones are not. Things like quaternary ammonium compounds. These would not be found in a formaldehyde containing fluid. They're very good surface disinfectants, and so they are used as terminal disinfectants a lot of the time. The most common quaternary ammonium compound is probably benzalkonium chloride. We talked about that before. Benzalkonium chloride is a good surface disinfectant, but again should not be used in the presence of soaps or formaldehyde because it will neutralize. So the soaps will neutralize benzalkonium chloride, as will the formaldehyde, meaning it won't work as a disinfectant anymore. So if you're going to use these kind of terminal disinfectants based on benzalkonium chloride, you have to get rid of all traces of soap and or formaldehyde. Glutaraldehyde is also a very good disinfectant. It's best used at 2% activated. Activated just means it gets buffered. Again, it is such a good disinfectant that its nickname is the cold sterilant. And so you will also find a lot of terminal disinfectants that are glutaraldehyde based. So now we'll look at the modifying agents of the arterial fluid. Again, a lot of these can also be found in co-injections. And so they might be found in an arterial fluid, they might not be. It might be something you have to add later. Humectants are the moisture retaining agents. Again, they help tissue to retain moisture so they don't dehydrate anymore. Gives tissue a pliable effect, so a little bit more lifelike. Very good for babies because babies get held. You want them to feel pliable. It can also help to protect tissue from the harsh reactions of formaldehyde. That's very important in dehydrated bodies. You want to avoid formaldehyde walling off those capillaries, searing them, and humectants can help with that. The common humectants you might find would be glycols, the dihydroxy alcohols, glycerol or glycerin, same thing, the trihydroxy alcohol, sorbitol and its isomers mannitol and dulcitol. The polyhydroxy alcohols are all used as humectants. Again, lanolin compounds maybe, but they're not good as internal humectants. They're better as external humectants. So on to moisturize skin, especially on people with dark complexions. If they dry out, they start to look ashy. So lanolin's really good for that as an external humectant. Not so good internally because they are it's an animal fat based compound. It's a wax, and it can coagulate in the body, meaning it can coagulate inside the capillaries, creating a hypertonic environment inside the capillaries, which can actually dehydrate the body. So I would not pump these into the body. There are modern chemicals that have what they call lanolin, but it's a synthetic lanolin, so it's not real lanolin. Some examples of some arterial fluids that have humectants. Plasdopaque is one from Dodge. It has a synthetic humectant in it. Atabalm and PLX are both from Champion, and they're both lanolin based, but again, it's not really lanolin. It's kind of a synthetic lanolin. Now, most arterial fluids have buffers in them. And again, a buffer is an amphoteric substance that helps arterial fluid resist pH changes in the body. Most arterial fluids are buffered to be a certain pH. Slightly acidic formaldehyde solutions will fixate tissue really well, and they work very quickly. The cavity fluids are buffered to be acidic. The high index fluids are buffered to be acidic. Most arterial fluids are going to be slightly alkaline because that helps to enhance the action of dyes. They don't fixate tissue as quickly, but they will fixate tissue. And so most embalming solutions are buffered between 7.2 and 7.4. Common buffers that you'll see in embalming fluids would be things like borax, or sodium borate is its kind of scientific name. Borax was used in the old days where they'd actually, just like the borax you buy at the store, they'd take a little scoop of it and put it in the embalming tank. We don't really use it as much anymore. Sodium phosphates are pretty common. The sodium citrates were once used as both buffers and anticoagulants, but they found out that the citrates were good environments for staph to grow, so they don't use it anymore. The most common ones probably now are the sodium salts of EDTA, ethylene diamine tetraacetic acid, because you get kind of 2 for 1 with that. It will act as a buffer. It will also act as an anticoagulant. Speaking of the anticoagulants are things that substances that will remove calcium ions from hard water. That's designed to help prevent clotting. Anticoagulants are not designed to break clots up in the body. That's a totally different type of chemical. And a lot of arterial fluids won't necessarily have anticoagulants in them. It might be something you might have to add. But they're also called water conditioning agents. They're also called water softeners. Again, know those extra names because they might have that on the bottle. The common anticoagulants, the most common, are the chelates. Again, the sodium salt of EDTA, which will also act as a buffer. Chelates are just a version of the sequestrant anticoagulants. The sequestrant anticoagulants, if you remember, will react with calcium and create a water-soluble product, so you don't see chunks floating around in your tank. Again, that was sodium citrate, but they don't use that anymore because sodium citrate is a good place for staph to grow. Some arterial fluids may have surfactants in them. Again, surfactants help to reduce surface tension. By reducing the surface tension of the blood in the capillaries, that will help to move that blood out of the capillaries, and that helps to facilitate your diffusion. They will also be called penetrating agents, surface active agents, wetting agents, or surface tension reducing agents. You'll find surfactants, again, not so much necessarily in embalming fluids, arterial fluids, though they may be there. You'll find them a lot in gels to help the gel penetrate the skin. The common surfactants that you'll run into would be the sulfonates and also sodium lauryl sulfate, which is a pretty common surfactant found in things like shampoo. If you look in the back of your shampoo bottle, you'll probably see something that's very similar to sodium lauryl sulfate. A lot of arterial fluids will have dyes that will help to recreate your natural skin tissue color and the texture of your skin. There are two types of dyes. Most of the dyes that will be found in arterial fluids will be active dyes because they're going to color your tissue. And it will also help you to trace your distribution, so that's good. The inactive dyes, which only color the fluid, tend to be found mostly in cavity fluids. They're designed there to be able to recognize different cavity fluids just by sight and not having to read the label. The common dyes are eosin, which is kind of a yellowish, it's red, but it has kind of a yellowish tint to it, good for elderly people. Erythrocin, which is a reddish color. Poncal red, which is an inactive dye. It's non-staining, won't stain tissue. It's kind of a cherry red color. And amaranth is another fairly common dye. It's a reddish color also. Skews a little bit more towards the orangish spectrum. This is an example of some arterial fluids that have these dyes in them. Chromatec, Neoform, TNX. All of them are dyed arterial fluids. Again, most arterial fluids do have active dyes in them. If they don't have an active dye, then they don't have a dye at all. The last of the modifying agents is the deodorants. If you remember, deodorants, the real definition of a deodorant is something that destroys an odor. So they're technically kind of using this term deodorant wrongly. How they define a deodorant is something that displaces or masks the harsh odors of the preservative. So the deodorants are not designed to cover the smell of decomposition. They're designed to cover the smell of the chemical. They're also called perfuming agents, or masking agents, or reodorants. Again, just designed to cover the smell of the chemical. And common ones that you might find would be things like benzaldehyde, which is a benzene derivative of an aldehyde. It smells like almonds. Oil of cloves is a derivative of what's called eugenol. Oil of sassafras is a derivative of safrole. And then methyl salicylate, or oil of wintergreen, which is the ester of methyl alcohol and salicylic acid. It smells like wintergreen. Again, these are designed to cover the smell of chemical, not of decomposition. So that finishes it up for arterial fluids. We're going to look at cavity fluids. Cavity fluid, technically it says it's a preservative. It's not really a preservative. The real reason for cavity fluid is for disinfection. It's to kill bacteria in the thoracic and abdominal cavities. That will then help to avoid gas formation, which helps avoid purge them. The composition of cavity fluids is roughly the same as arterial fluids, except it has a lot higher concentrations of disinfectants and preservatives. Even though you might have very low-level low-index cavity fluids, for instance, SynCav is about a 10 index. That's really used for topical embalming more so than cavity work. They generally do not contain active dyes anyway. They oftentimes will contain inactive dyes. They don't really have many deodorants or many modifying agents in general. You don't need humectants, you don't need anticoagulants, you don't need surfactants. You don't need any of that for cavity fluid. Their pH tends to be between 4.5 and 5.2. Again, they're buffered to be acidic so that they work quickly and fixate tissue really well. Some examples of some different cavity fluids, like dry cav, SynCav, very low index, Firmatone. And now notice that dry cav is pink and the SynCav is blue. Those are inactive dyes. They're not there to stain tissue. They're there for recognition of the fluid. Okay, so that's going to finish it up this time for embalming fluids. Next video, we're going to go through the accessory fluids, pre-injections, co-injections, and some other types of chemicals that you'll run across.